We started on contact investigation, and there were three major areas of contact. One was the primary care provider's office. One was a local restaurant here in town, and thank goodness it was not one of the fast food places. This was somewhere where they know a higher percentage of their clientele, and more people tend to pay with plastic, and so we were able to get names to be able to call these people. And a pharmacy, and they pulled the prescriptions that came in during that time, and they also pulled their surveillance tape and told us where the person had been. The thing with measles is that it's an airborne transmission, and they have, thank goodness, gone from 4 hours after the person leaves wherever the exposure is down to 2 hours. So we had to look at 2 hours on all of those. So we made contact with about 40 to 45 people. We gave about 20 to 25 MMRs, and you are considered immune if you have had 2 MMRs, measles, mumps, and rubella vaccines, or if you're old like me and have had the disease. We ended up giving one infant and 11, almost 12-month-old child an MMR, and we gave immune globulin to one child that was too young to be able to qualify for the MMR. During this time, we did provider alerts. Every day we made up new alerts to blast fax out to all the providers in town, letting them know if somebody's coming into your office, this is what you need to do. If somebody's calling and saying, I'm sick with a fever and a rash-like disease, don't let them in the door. But talk to them and find out, make arrangements to sort of sneak them in the back or something like that. And of course, the index case had traveled on an airline. So we worked with CDC. They take care, thank goodness, of airline notification. We worked with Multnomah County because this person obviously landed at PDX. Worked with New York City Public Health Department on possible contact for index cases in New York. And then, as I say, we worked with Washington and Utah. We had to get a special shipment of immune globulin. We used to carry it in the health department all the time, and it's used, at that time, was used primarily for prophylaxis for hepatitis A. But since we now have hepatitis A vaccine, it's not used much. And so, fortunately, there was a state worker going from Portland to Baker City, and she swung by our office with immune globulin. We worked with Providence Memorial Hospital because, of course, we're talking Friday here. And so we had been working so that their emergency department staff would be up to speed. They had immune globulin on hand. We said, if you need more, we'll provide you with more. We, quote, went public on Friday, April 1st with radio in Spanish and English. We had it on the county webpage, and the article came out Friday/Saturday in the newspaper for people to see. The follow-up was really great. None of the health department employees had calls from the public over the weekend, and we didn't have any calls on our answering machine on Monday morning. The health officer did not have any calls from providers, so that they felt comfortable with what they were doing. And miracle of miracles, no one either called or showed up at the emergency department. And they're just inundated when anything comes up with worried well and panicked people. So that was amazing. This was lab confirmed on April 2nd. 1.2 is considered positive, and this person's results came back at 12. So no doubt on what was up there. And because of giving immune globulin, that of course affects the immune system. And so related to those first exposures, the good news is that hopefully on Wednesday, the 20th, we'll be finished with that. One child who had been in the primary care provider's office was 11 and a half months old, as I said, and got an MMR on the 30th. That child, however, started running a fever on the 8th. and a rash on the 11th, and a clinical diagnosis again of measles was made. This time we collected specimens and they were sent directly to CDC. And what they do there is genotyping, and what's called wild virus that's out and community acquired is different than the virus that is in the vaccine, and so that's why they're doing the genotyping, is to make sure whether this child actually is sick or is having a reaction to the vaccine, which can happen. But this little guy is looking probably like he's got the disease, actually. But those results are still pending. We had hoped to have them on Friday. We still didn't have them when I left the office a little bit ago. And so because we don't have that lab confirmation, we again went ahead with contact investigation. And the contact investigations, or the contacts were in the child's home and grandparents' home. And this time we got lucky. There were only about 15 people that had to be followed up on. We gave 12 MMRs, and we ended up giving immune globulin to one pregnant woman. This woman had had 2 MMRs, but because she was pregnant and not a whole long way from delivery, her doctor ran a titer level, and it did not come back strongly positive. And we certainly would not want this new mom and potentially her infant to come down with it. So I don't know if any of you have ever experienced immune globulin for hepatitis A, but the dosage for measles is huge. This woman got 15 cc's of immune globulin, which is a gigantic dose, and immune globulin is about the consistency of egg whites. So it's a fun thing, and fortunately, I'm not the one who had to give it. The good news is that the child is not extremely ill, so even if this is an actual case of measles, it was modified by getting the MMR. That is, immune globulin or MMR are the 2 options when there's been an exposure. So, as I say, there have been clinical markers of the disease, but the child has really not been terribly ill the way measles can make a person.